Good morning, good morning. Hi, everybody. Welcome to our webinar for October on Medicare. We're so excited to have everybody. We see a lot of people coming in. Hey, everybody. Welcome, welcome. We're about 2 minutes away from getting started on our webinar for today. I just want to say hello to everyone. We have a great topic. We're super excited to be here today to present information about Medicare, which is very timely in October. October is kind of Medicare information month. So we're just watching everybody kind of come into the event today. We're potentially going to have over 100 people here, which that just gives you an idea of how important this topic is, particularly for October. And we're just going to wait a couple more minutes till everybody's in, and then we will begin the webinar. Welcome, welcome. We sure wish we could see everybody in person. This has just been crazy, going on too long, right? These webinars, but we're so happy that we can still present information that is timely and important for everybody. We just have some more people who are popping on. We know our speakers here, so that's always a good thing. And it is 10:30, so we'll go ahead and get started. Welcome, everybody. My name is Cindy Cummings. I am one of the members of LT Senior Services, and LT Senior Services is a nonprofit, and we are located in the Lake Travis area. Our purpose is designed to be a resource to serve and engage aging adults and their families in the community. And we are in the Lake Travis area, but now that we have gone online to webinars, we have people from all over the country who join our webinars. And we welcome you here today. We're super excited. Our topic is about Medicare, which in October makes total sense because this is when all the Medicare changes come out. And we're so excited to have Scott Gidley here. He's an expert in Medicare, and we'll be introducing him in just a little bit. But before we get started, I'd like to go ahead and just talk about LT Senior Services. We do have a directory. We provide, oh, it looks like our banner there too a little bit. But we do educational series across the Lake Travis area. And again, like I said, we're doing webinars, so we're excited to have people outside the area. And we've been doing these webinars ever since COVID. We normally would be doing them in person. We'd be doing them at, we have 3 library locations, the Lake Travis Library, the Bee Cave Library, oh, not the Bee Cave Library, Laura Bush Library, we've held them there, and then in town, we've held them at a library in town. So of course, all of that changed with COVID, and now we've gone online. One of the great things about going online is that we have a YouTube channel now. So if you go to our YouTube, you can see our previous seminars from this year, and we have some really informative seminars with lots of great people who have great information. So we're kind of building that library. I guess that's a positive. I think everybody's trying to find the positive in COVID. So we are a membership organization. We have over 40 members, and some of them are nonprofits and many of them are businesses. We have some of those members here today, and we're going to introduce them. First, I'll start with myself. My name is Cindy Cummings, and I am a real estate agent with Realty Austin. I also have an ancillary business called Turnkey Transition, where we help with project management when you're moving from your home to a senior living community or in with family or wherever. So that's what I do. I'm going to go ahead and bring in some of our other members. The first is Karen. Karen, do you want to come on in? I'm going to ask you to start your video, and you are muted, so if you'll just unmute. Hey Karen, it's so good to see you. Tell us what's going on at the library now. Things are ever changing, aren't they?
Yeah, the library is still doing curbside reserve pickup service, so you can request items and then pick them up. But we did extend the hours, so we're doing now curbside 6 days of the week. So on Monday, Tuesday, and then Thursday, Friday, Saturday, you can pick up items between 11 and 3. And then we started a Wednesday happy hour service in the evening from 5 to 7. So if the daytime hours don't work for you, we'd love for you to pick up your items in the evening from 5 to 7 on Wednesdays.
Do you include a happy hour drink?
I wanted to, but it's not, I don't think we're allowed to at the library, but we definitely talked about it.
That's so funny. Maybe you could just give them a menu or a recipe for a fun drink for the month.
Yeah, a
So
little
for
like, yeah,
October, what would it be? Something pumpkin-y or,
pumpkin spice something, yeah.
yeah, that'd be fun. Well, and as always, I love to tell people about all the technical services that you offer. So if you're having trouble with your iPad or your phone, you can actually contact the library. You have volunteers who are helping. Is that right?
Yes, we have a tech coach help Wednesdays at 10:30 with a staff member. It's sort of focused around like one theme, one technology thing that you could learn. But then also we have a bunch of tech coaches who used to volunteer in the library and now they're going online. So you can email techcoach@laketravislibrary.org with any questions and they'll arrange to try and set something up with you virtually. And
Excellent.
we also have a cool speaker series every Wednesdays at 2. There's a Learning with the Library series that got launched. So this Wednesday is the Space Science Institute, like guest speakers coming in. And I think she's talking about the Mars rover, which sounds really cool. So it's for
Oh
all
my
ages.
gosh, that is awesome. So now going online, that's where you can get these speakers from all over, right? Where's she
Exactly. And
from?
then she is from, I think, the Space Science Institute,
So
which I'm not
probably in
exactly.
Florida or someplace like that.
Yeah,
That's
I
super
should know.
cool.
Yeah. And then one talk also is a tour with the at the Wildflower Center, like a virtual tour.
Awesome. Well, that's great. Well, we love the library. The library's been such a good supporter of LT Senior Services. We're so happy to be partners with you. Thanks for coming in and giving us your scoop today. And
Thank
I'm
you
going to
so
go ahead and
much.
thank you. We're going to go ahead and invite Ray to come on in. Ray, you want to come in and say hey? So Ray is one of our members and he just needs to work. Look at this technology. We're doing awesome, aren't we? Go ahead and unmute yourself, Ray. Yeah, you need to unmute.
Well,
There you go. Oops, it happened again. You muted again.
okay, now I'm unmuted.
Perfect.
Good morning,
Good
Cindy,
morning.
LT Senior Services. I'm Ray Daniel. I'm with Fairway Independent Mortgage, and I work in the reverse mortgage division of Fairway. I live and work here in Lakeway. My job is to help seniors navigate retirement by helping to use their home equity as another means to create cash flow for the future of their retirement over the next 20 to 30 years. Now is a great time to look at a reverse mortgage, mainly because we're at 40-year all-time low interest rates. That's why the real estate market is doing so well, is that rates are incredibly low. I'm talking high twos, low threes. So now is the time to look at it, and you can actually end up borrowing more money because of those low rates, or getting access to more money. If you have a current mortgage, now is a great time to refinance that mortgage into a reverse mortgage. Only requirement is that you need about 50% equity in your home. But by doing that, you go to a reverse mortgage, which has no payments for the remainder of your lifetime in that home. So it's a great product to use, and I can help you understand it and answer all your questions. So I'm going to put all my contact information in the chat box. So thank you, Cindy, for allowing me to come on this morning.
Absolutely. So good to see you, Ray. And you have been a great partner. I know I've been referring my clients to you, both for purchase. You can use a reverse mortgage to purchase a home, and you can use a reverse mortgage to stay in a home. So we have people who are moving from outside the area, and Austin is more expensive than, say, Abilene or someplace like that. So they're able to take the money that they get in another city and buy a similar or a nice home using the reverse mortgage.
It basically doubles your buying capacity. If you're looking at a $400,000 home in Austin, you can get into that home for around $200,000 and not ever have a payment going forward.
Awesome. I just got a message that the person who's going to be speaking at the library is from Boulder, Colorado, not from Florida. So, Ray, thank you so much for joining us,
Thank
and
you.
we will see you next time.
All right, appreciate it.
Let me see if I can get you off. And now, without further ado, Mr. Gidley, will you come on, please? And I'm going to ask you to start your video. Hey,
How are
how you
you?
doing, Scott?
I'm doing well, and I'd like to think of Mr. Gidley as my dad, but I guess I'm getting older myself, so.
Isn't that funny? Well, this is a big birthday week for me, but it was so fun. I had a Zoom birthday call with all my sorority sisters,
Oh,
and they
good.
said, how can you be turning 60? And I said, yeah, I feel like I'm 29. And I think that's, you meet people who feel like they're young, and you meet people who feel like they're old even when they're 50s. So I don't know, it's a state of your mind, don't you think?
State of mind, and I'm over 60, so I'm also a Medicare eligible person. So not only do I talk about this topic, but I live the topic.
Yes, that's awesome. So you've actually experienced it. Well, let me read your short bio and then we'll get right into it. And just to let you know the format today, we're going to have Scott present the information. It's an educational event. And so he'll explain a little bit more about that. We would love for you to ask questions in either the chat or the question and answer bar. And what we'll do after he's done presenting is we'll ask him the questions that you've asked. So isn't this fun? I'm working from home, and so I got a dog barking, but what are you going to do? I mean, it's the new life. Before that would be so unprofessional. Now it's like, it's just a reality. Okay, so without further ado, a long-term resident of Lakeway, Scott has actively supported our community by serving on boards and task force, fundraising for scholarships, teacher grants, LTISD organizations, and youth sports, volunteering with several local nonprofit organizations, reading to local elementary students through the Literacy Partners Program, and by coaching, refereeing, and umpiring LTYA sports. Scott's wife, Beth, is a soon-to-be retired banker with Independent Bank in Lakeway, and their two daughters attended and graduated from LTHS, and both are now teachers in LTISD. With over 30 years of experience in financial services, Scott Gidley is the president of Charitable Financial Partners, a local financial firm that provides objective and independent Medicare insurance planning advice, as well as comprehensive wealth management services. So, Scott, welcome. We're so happy that you're
Thank you.
here. We know that October is the time that people start thinking about making changes with Medicare. And
Yes.
so without further ado, I'm going to have you take over the screen, and I'll come back when you're done.
Well, Cindy, thanks for inviting me to speak again about Medicare in another Lake Travis Senior Services gathering. This time to talk about changes in Medicare for 2021. I appreciate the opportunity to share this information with seniors in our Lake Travis communities. And hopefully, after this webinar, you might be able to better understand some current Medicare facts and be more prepared to think about what's best for you in terms of smart Medicare planning. I think it's prudent to review your Medicare planning annually because each year some important changes occur that could have a significant impact on your Medicare costs and strategies. As Cindy's pointed out, the timing is right. This year's annual enrollment period starts this Thursday, October 15th, and ends on Monday, December 7th. Now, before I start talking about Medicare, I need to make a brief statement about compliance. Medicare is highly regulated, and rightfully so because, unfortunately, fraud and unethical marketing and selling practices are pervasive. As a licensed Medicare insurance agent, to conduct this Medicare event, I had to file a request for approval with Medicare. We are approved today for a formal educational event, so I won't be able to specifically discuss Medicare products, but you can reach out to me after this webinar with any questions you might have about products or strategies. With that being said, let's proceed and talk about changes in Medicare for 2021. I'll present some facts and some topics, and then please ask any questions that you might have. Well, let's start with Original Medicare. What about Original Medicare Part A? Original Medicare Part A covers hospitalization costs, and there are out-of-pocket costs when you need hospital care. You will have to pay a premium for Part A if you or your spouse do not have 40 quarters of Medicare withholdings in your work history. Are these Part A premiums increasing in 2021? Well, approximately 1% of Medicare Part A enrollees pay premiums. Part A premiums have trended upward over time, although they are actually lower in 2020 than in 2010. For 2021, the Part A premium for people with 30 but fewer than 40 quarters of work history is projected to be $263 per month, up from $252 per month in 2020. For people with fewer than 30 quarters of work history, the Part A premium is projected to be $478 per month in 2021, up from $458 per month in 2020. The exact amounts for these Part A premiums will be finalized by the Centers for Medicare and Medicare Services, also known as CMS, in late 2020, usually provided in November. Another question, are Part A deductible and coinsurance increasing in 2020? Part A has a deductible that applies to each benefit period rather than a calendar year deductible like Part B or private insurance plans. This deductible amount generally increases each year. In 2019, it was $1,364. In 2020, it increased to $1,408. It is projected to be $1,452 in 2021, and again, the exact amount will be finalized soon by CMS. The deductible increase will apply to all enrollees, although many of you might have supplemental coverage in place, such as Medigap or Advantage plans, that pays all or part of the Part A deductible. The Part A deductible covers the first 60 days of inpatient hospital care during a benefit period. If you need inpatient care beyond 60 days during that same benefit period, there is a daily coinsurance charge. In 2020, this coinsurance charge was $352 per day for the 61st through the 90th day of inpatient care. It is projected to increase to $363 per day in 2021. The coinsurance for lifetime reserve days is $704 per day in 2020. It is projected to increase to $726 per day in 2021. For care received in skilled nursing facilities, the first 20 days are covered with the Part A deductible that was paid for the inpatient hospital stay that preceded your stay in a skilled nursing facility. Medicare covers skilled nursing facility care only if you had an inpatient hospital stay of at least 3 days before being transferred to a skilled nursing facility. There is a coinsurance that applies to days 21 through 100 in a skilled nursing facility. In 2020, it is $176 per day. For 2021, it's projected to be $182. Well, the next question I'd pose, or topic to discuss, is will the original Medicare Part B premium increase in 2021? The standard premium for Part B in 2020 is $144.60 per month. It has been projected, well, I should say it had been projected to increase to $153.30 in 2021, but in October 2020, our government enacted a short-term spending bill that includes a provision to limit the Part B premium increase for 2021. Under the terms of this spending bill, the increase for 2021 will be limited to 25% of what it would have been. Part B premiums for the majority of Medicare beneficiaries will also depend on the size of the Social Security Cost of Living Adjustment, also known as COLA, for 2021. In some years, small COLAs have limited the amount of Part B premium increases. A COLA of about 1.3% is projected for 2021, which would have been sufficient to allow for the full projected Part B increase for most beneficiaries before the spending bill imposed a smaller cap. If a Social Security's recipient's COLA is not enough to cover the full premium increase for Part B, the Part B premium can only increase by the amount of the COLA because Part B premiums are withheld from Social Security checks, and net Social Security checks cannot decline from one year to the next. How much will the Part B deductible increase in 2021? The Part B deductible is $198 in 2020, up from $185 in 2019, and up from $183 in 2018 and 2017. This Part B deductible has not yet been declared for 2021, but numbers from previous years kind of give us a good idea of the general range it might be. Some enrollees have supplemental coverage that will pay their Part B deductible, such as Medicaid, employer-sponsored plans, and Medigap Plans C and F. Now, Medigap Plans C and F can no longer be sold to newly eligible enrollees as of January 1st, 2020. You can keep these plans if you already have them, and those who are eligible for Medicare prior to January 1st, 2020 can continue to purchase them. The ban on the sale of Medigap plans that covers the Part B deductible for new enrollees was part of the Medicare Access and CHIP Reauthorization Act of 2015, also known as the acronym MACRA, M-A-C-R-A. MACRA was an effort to curb the utilization of Plan Cs and Plan Fs by ensuring that enrollees incur some out-of-pocket costs when they receive medical care. Now, many Medicare Advantage plans have low co-payments and deductibles that do not increase in lockstep with the Part B deductible. Their benefit designs have had different fluctuations over the past few years. Now, as I pointed out, but let's talk again just briefly, can you still buy Medigap Plan C and F? As a result of MACRA, Medigap Plan C and F, including the high deductible Plan F, are no longer available for purchase by those who become eligible for Medicare after December 31st, 2019. So if you turn 65 on January 1st, 2020 or later, you can't purchase Plan C or F. People who became Medicare eligible prior to 2020 can keep Plan C or Plan F if they already have them, or they can still apply for these plans at a later date. Now, it's important to note that medical underwriting applies in most states if you're switching from one Medigap plan to another after your initial guaranteed issue enrollment period ends, which typically is age 65 and a 6-month period after that. Medigap Plan C and F cover the Part B deductible, which is $198 in 2020 in full. But other Medigap plans require enrollees to pay this Part B deductible. Again, the idea behind the change is to discourage overutilization of services by ensuring that enrollees have to pay something when they receive outpatient care, as opposed to having all costs covered by a combination of Medicare Part B and a Medigap plan. Because the high deductible Plan F has been discontinued for newly eligible enrollees as of 2020, there is now a high deductible Plan G available. Well, another thing to consider, are there inflation adjustments in high income brackets? Medicare beneficiaries with high incomes pay more for their Part B and Part D prescription drug plans. Now, what does this high income mean? High income brackets were first introduced in 2007 for Part B and in 2011 for Part D. For several years, they started at $85,000 for an individual filing as an individual tax return and $170,000 for a married couple filing jointly. These income brackets began to be adjusted for inflation in 2020, with the start of the high income range increasing to $87,000 per year for individual and $174,000 per year for a married couple. For 2021, these thresholds are projected to increase to $88,000 for a single person and $176,000 for a married couple. Also for 2021, The Part B additional premium, the acronym IRMA, income-related monthly adjustment amounts for high-income beneficiaries is estimated to range from $215 per month to $521 per month, depending upon your modified adjusted gross income, also known as MAGI, as reported in 2019, up from a range of $202.40 per month to $491.60 per month in 2020. Just kind of as a side note, these premiums are always determined by what your MAGI was 2 years previously. So in 2021, it's based on your MAGI and your tax return in 2019. In 2022, it'll be based on your MAGI and your tax return in 2020, and so forth. So as a part of the Medicare payment solution that Congress enacted in 2015, that MACRA bill, new income brackets were created to determine additional Part B premiums for high-income Medicare enrollees. These new brackets took effect in 2018, bumping some high-income enrollees into higher premium brackets. Starting in 2019, a new income bracket was added on the high end, further increasing Part B premiums for enrollees with very high incomes. Rather than lumping individuals with income above $160,000, $320,000 for a married couple, into one bracket at the top of the scale, there now is a bracket for those with an income of $500,000 or more, or $750,000 or more for a married couple. Those in this high category pay $491.60 per month for Part B in 2020. The projection is that they will pay about $521 per month in 2021. The income level for the top bracket, $500,000 plus for an individual or $750 for a couple, remained unchanged in 2020. But the thresholds for each of these other brackets increased slightly, starting with the lowest bracket increasing from $85,000 to $87,000 and so on. A similar adjustment applied to each level except the highest one. Another question. How are Medicare Advantage premiums changing for 2021? According to CMS, the average Medicare Advantage premium for 2021 is expected to be $21 per month, down from $23 per month in 2020. Average Medicare Advantage premiums have been declining for the last few years. Interestingly, the average premium for 2021 is the lowest it has been since 2007. When you consider Medicare Advantage plans that include Part D prescription drug coverage, also known as MAPDs, the average premium in 2020 is about $36 per month. So those who enroll in Advantage plans pay their Part B premium plus whatever the premium is for their Advantage plan. The private insurance company wraps all these coverages into one plan in a Medicare Advantage plan. Now, about 24 million people had Medicare Advantage plans in 2020. CMS projects that this will grow to 26 million in 2021. Enrollment in these plans has been increasing for the last 15 years. The total number of Medicare beneficiaries has been steadily growing as well. But the growth in Medicare Advantage enrollment has outpaced overall Medicare enrollment growth. In 2004, for instance, 13% of Medicare beneficiaries had Medicare Advantage plans. In 2020, that figure had grown to 36%. Now, here's another topic. Is the Medicare Advantage out-of-pocket maximum changing in 2021? Medicare Advantage plans are required to cap out-of-pocket costs for Part A and Part B services, unlike original Medicare, which does not have a cap on out-of-pocket costs. The cap does not include the cost of prescription drugs because those are covered under Medicare Part D, even when it is integrated with a Medicare Advantage plan. For the last several years, this out-of-pocket maximum cap was $6,700, although most plans have caps below that level. For 2021, the maximum out-of-pocket limit for Medicare Advantage plans is increasing to $7,550, not including your out-of-pocket costs for prescription drugs. Most plans will continue to have out-of-pocket caps below the maximum, but it's important to recognize that the increase for 2021 is significant. Now, another topic, how is Part D prescription drug coverage changing in 2021? For standalone Part D prescription drug plans, the maximum allowable deduction will be $445 in 2021, up from $435 in 2020. Once you and your plan spend $4,130 combined on drugs, including the deductible, you will pay no more than 25% of the cost for prescriptions until you reach the out-of-pocket threshold. The out-of-pocket threshold, where catastrophic coverage begins, will increase to $6,550 in 2021, up from $6,350 in 2020. The co-payment amounts for people who reach the catastrophic coverage level in 2021 will increase slightly, $3.70 for generic and $9.20 for brand name drugs. And you will pay no more than 5% of the cost for covered drugs for the rest of the year. Some good news is that as of 2020, there is no longer a donut hole for generic or brand name drugs. Previously, enrollees paid their deductible and then paid 25% of the cost until they reached the donut hole. Then they're responsible for 100% of the cost until they reach this catastrophic coverage threshold. That's now changed. What other changes are coming to Medicare in 2021? In 2021, there are now benefits for end-stage renal disease, otherwise known as ESRD. If you have ESRD, you will now be able to join a Medicare Advantage plan, whereas previously you could not. In addition, co-payments may change for such things as primary care physician services, specialist doctor services, skilled nursing care facility care, emergency care services worldwide, ambulance services, dental, vision, and hearing services, podiatry services, acupuncture and chiropractic services, cardiac rehabilitation, outpatient lab tests and x-rays, outpatient occupational, physical, and speech therapy, outpatient mental health, outpatient substance abuse, and opioid treatment program services. What is Medicare's 2021 budget and plan? Another one of the changes coming in 2021 is the federal government's new budget to help reduce Medicare spending. This new budget estimates that spending will decrease by 7% between 2021 and 2030. The 2021 budget expects to reduce Medicare spending by making some changes. One is to allow patients to see nurse practitioners as their primary caregivers. Also, reimbursement rates to providers may see a reduction, although reducing reimbursement rates probably will be a cause of controversy. Decreasing or minimizing these rates may save you money, but you could possibly lose access to some doctors. Now, what about some upcoming changes to Medicare Advantage plans in 2021? The coverages in Medicare Advantage plans will be seeing some changes in 2021 as well. Advantage plans will be increasing their telehealth and other virtual services and coverages. Besides this increase in telehealth care, those who live in rural areas may see an expansion of plan options. CMS is granting the flexibility to include telehealth providers in specific areas. And some of these specialties that will be available in rural areas will be primary care, dermatology, psychiatry, cardiology, gynecology, and endocrinology. Now, next topic. Will there be a reduction in drug costs in 2021? The government's budget called on Congress to pass a Part D senior savings model. This reform is estimated to reduce the federal deficit by $135 billion over the next 10 years. Notably, there will be a significant reduction in the cost of insulin as well as erectile dysfunction drugs. In 2021, those with diabetes can join participating Medicare Part D prescription drug plans and Part C Medicare Advantage plans that will have caps on insulin pricing. Monthly co-payments will not exceed $35 for a 30-day supply and will be $30 for a 30-day supply at preferred pharmacy locations. Indeed, this is a significant, if not substantial, reduction in insulin costs for diabetic treatment. Those who do not receive extra help with Medicare Advantage prescription drug plans, chronic special needs plans, also known as CSNPs, and dual special needs plans, also known as DSNPs, will be eligible. If you enroll in a participating Part D or Advantage plan, you will pay $35 or less for a 1-month supply of covered insulin until you reach the catastrophic stage, at which point you will pay 5% of the cost of your insulin. Now, I'll point out here, covered insulin. The insurance companies will provide a list of the insulin products that are covered underneath this new participating plan. So it's important that you check with your pharmacist to make sure that, one, your plan is a participating company in this cost reduction, and two, that they do have in supply the insulin named drugs that are also available to have these reductions. Will there be a star rating change in 2021? Another change in 2021 is how CMS is handling the star ratings. These ratings help you compare the quality and the customer service experience with Medicare health and drug plans that you receive from Medicare insurance companies. CMS approved these changes in March 2020 for the 2021 star ratings. Another thing to consider is, what are the physician fee schedule rule updates? 2021 will also bring some changes to the physician fee schedules. This rule will keep intact proposed cuts to psychologists, physical therapy, and social workers. Physicians will see payment cuts of 8%, and payments to social workers and psychologists will be cut by 7%. Now, yes, we're in the midst of open enrollment starting on October 15th, but it's important that you pay attention to a piece of mail that you received probably a couple weeks ago. And that's called the Medicare Plan Annual Notice of Change. What should you look for? As I said, this is the time of year when you'll receive a lot of information about Medicare, sometimes wanted, sometimes unwanted. The intent is to keep you informed and to help you understand your coverage choices and to make informed decisions during the annual enrollment period, again, October 15th to December 7th. There's one piece of Medicare mail that you want to be sure to read, the Annual Notice of Change, ANOC, A-N-O-C for short, that comes from your current Medicare plan provider. Delivered by October, it's supposed to be delivered by September 30th. These ANOC letters ensure that plan members have up-to-date plan information before the Medicare annual enrollment period begins on October 15th. Now, how do we understand these ANOCs? Your Medicare Advantage or Medicare Part D prescription drug plan ANOC letters provide important information which can help you decide whether to keep your current plan or to consider a new one during AEP, annual enrollment period. Advantage plans and prescription drug plans are offered by private insurance companies under contract with Medicare. Each year, these insurers review their plan details and will make changes as needed to better serve their plan members. Well, here's what to look for when you get your ANOC letter. along with some questions to help you understand plan changes and what they might mean for you. Coverage changes. What new benefits have been added to your plan? Are there other changes that affect services you use? Have there been any changes in your health that may affect what services you need or how often you may need them? If your health has changed, will your plan benefits cover the additional care you may need? You also need to consider provider network changes. What providers have been added to or removed from the plan network? Are your current doctors in the network? What about hospitals or other providers or specialists you may need? If your providers are not in the network, are you willing to switch to other providers that are? Now, there are also changes in drug lists and pharmacy networks. What medications have been added to or removed from the plan's covered drug list, also known as a formulary? Are the drugs you currently take listed on the formulary? Have any medications been assigned to a different tier on the formulary? This may affect your copay and your deductible. Is your pharmacy in the plan's network? Is it a preferred pharmacy that offers the plan's best pricing? Now, there can also be some cost changes. Is the plan premium going up, going down, or staying the same? Are there any other costs changing, such as deductibles, co-payments, or co-insurance? If you have a Medicare Advantage plan, what is your maximum out-of-pocket limit? How will cost changes affect your total out-of-pocket spending for the services and prescriptions you may need? So check with your plan if you're unclear about anything in your ANOC, and you'll notice it changes, or if you did not receive this ANOC letter. You can call the customer service phone number on the back of your member card to ask these questions and to ask for getting a copy of this ANOC letter that pertains to your plan. Also, I think it's important to review your Medigap plans periodically as well. Don't assume that once you've purchased a Medigap plan, also known as a Medicare supplement plan, that you never have to look at it again. If you're healthy and you do not take certain drugs that would prohibit your being medically underwritten and approved, you may want to periodically review these Medicare, Medigap, Medicare supplement plans too, because there could be some cost savings. So, knowing that Medicare is about as clear as mud to some or most people, and assuming that you're not too bored or falling asleep by now with all these exciting Medicare facts and topics, what questions may I try to answer for you?
All right, so I'm going to ask these questions. And the first one is, if one changes from traditional Medicare with Medigap to a Part C Medicare Advantage plan, then the following year wants to go back to traditional Medicare with Medigap, will the Medigap premium be subject to medical underwriting?
Well, every company will differ a little bit, but typically, and by and large, you have a 1 year free period, a 1 year window that says, if I don't like this Medicare Advantage plan and I want to return back to my Medigap plan, you have a 1 year period in which to do that, and you won't be subject to medical underwriting. Now, there are a couple companies that allow a 2 year window, but by and large, just know that you have a 1 year grace period. And if you don't like how it's working, and if it's not what you wanted to do and you want to go back, you can go back without medical underwriting. If you go 365 days, I should say 366 days or more, you will be subject to medical underwriting.
Okay, great question. Here's another one. I turned 65 on September 3rd. When should I start taking action such as enrolling? Will I be mailed information from SSA?
When you turn 65, or as you approach turning 65, you have what's called an initial enrollment period. You know, we're just full of these acronyms, IEP. And the IEP is a 7-month window. You take the month in which you turn 65, you go back 3 months, and then you go forward 3 months. So if she turns 65, or this person turns 65 in September, that's August, and then July and June. So effective June 1st, And then September, October, November, December through December 31st, you have that window in which to sign up for Medicare. Will you receive notification from Social Security? Probably. If you have worked for 40 years or longer, like we talked about previously, you'll probably get correspondence and get your red, white, and blue card that says that you have Medicare Part A, which is hospitalization. Now, you then need to decide, do I sign up for Part B, which is doctors and outpatient procedures? And that's something you have to pay attention to, because if you don't sign up for that in this window, you could be subject to late enrollment penalties. Now, do you have to sign up for Part B? Absolutely. Maybe, maybe not. If you or your spouse are covered under a group plan where you still have creditable coverage, is what they call it, you can defer signing up for Part B and starting to have to pay for that Part B premium until after you are no longer covered under that group plan. So I always suggest to my clients that, yes, pay attention to that window. Make sure that you get your red, white, and blue card that at least covers Part A. And if you don't get it, you can go online to Medicare.gov. You can make a phone call to the local Social Security office, or you can go in and get an appointment and talk with someone in order to get that card. So is that helpful? Did I answer the question?
Yeah, I think that was great.
Yeah.
We are now in the question and answer period. So guys, if you have any questions, please ask those. If there's any members of LT Senior Services that have popped on that would like to say, hey, we'll go ahead and do that also. We have a poll. Scott, do you mind if I do the poll real quick while we're waiting to see if we get some more questions?
Yeah, you're the boss.
Okay, so here's the first poll. Oh, let's see. So launch the poll. This is a question we would love to get answered from the participants here today. How would you like to see our topics presented in 2021? Believe it or not, we're already planning for that. Would you like to go in person? Would you like to do via Zoom, or either? You know, we're trying to figure out the plan, and we just don't know what people want to do. So we're hoping people here on this webinar today will give us some feedback on that. And we do have another poll, but we're going to keep this one up for a little bit. And I'm looking in question and answer. I don't see any. I don't see any in chat. One of the questions I have, Scott, is there anything that you have seen in all of your years of helping people with Medicare that is a big problem that somebody did that you're like, oh, if I would have just met you or known you, I could have told you to do something different? So, for example, applied when they shouldn't have, they applied too soon, just whatever. Tell us one of your stories.
Well, I would say paying attention to enrollment periods is probably the most important and most crucial experience that I've had. When you have people that don't pay attention to it, and suddenly they're 67 years old and they haven't done anything, and then they're subject to late enrollment penalties for the rest of their life, that's painful. So it's important to work with people and let them know that they do need to act during these enrollment periods. The question you brought up earlier is also important. Some seniors will get to the point where their Medigap or Medicare supplement premiums keep going up and up and up and up, and they decide to consider an Advantage plan in order to reduce costs. Well, they just need to be aware that it's a different product. It's very similar to going back to a group plan where you're going to have copays and you're going to have some deductibles that you might not have had with your Medigap plan. And then, I mean, I just believe in full and fair disclosure. People should know that. And then, of course, if they don't like it and it was a bad experience and they want to go back to their Medigap plan, it's very important to do that within that 365-day period. So I've had a couple clients that I've had to help with that, and it's important to pay attention to it.
Yeah, very good. So we do, I'm just going to ask if, Richard, did we answer your question? Is that more of a comment? Both would be great. If you would just let me know if we've answered that or not. And in our polling, it looks like 77% want to continue virtual. And then we had 23% who said that they would do either in person or Zoom. So I guess I'm glad I'm learning Zoom. It's crazy. So here's a question. My husband is on Social Security disability. He qualifies for Medicare after 2 years. We are on COBRA right now. When he qualifies, do I also? And she's under 65. That is a great question. So her husband's on SS disability right now.
You know, that is a good question, and rather than responding that and not come up with the right answer, I think I'd rather research that and respond if you'd like to send me that an email for that. But certainly, yes, Social Security disability, there's a 2-year window, and the husband would qualify after that 2-year period. I'd like to brush up a little bit on, you know, would the spouse also be covered under that Social Security disability? So rather than answering it incorrectly, I'd rather defer that.
Excellent. And I just, everybody, just to let you know, you can go to the chat, and in the chat, you're going to see Scott's information there, and you can always reach out to him. So we're going to do another poll. I'm thinking that we might get another question. So we have, we're trying to figure out our topics for next year. So this poll might take you a little bit longer, but we'd like to rate your interest in the topics that we have held in the past. So one is your aging brain, one is managing your balance, so et cetera, et cetera. So just go in there and tell us not interested, somewhat interested, very interested. And what we'd like for you to do in the chat, if you see a topic, if you don't see a topic that you think would be interesting, if you would go ahead and put that in the chat. So can you believe that it is October and here we are already planning for 2021? It's crazy. And we don't even know what 2021 is going to bring. What you doing, Scott?
I don't know.
You're like, I'm ready for a question. Let's ask him some more questions.
Yeah, I was
Anybody
just
have any
clicking on
questions?
this Q&A box and I was kind of looking to see if there's anything else.
Anything else interesting? Well, there sure is a lot of information that you've presented, and I know that everybody's situation is different. And so some general questions are good, but when you get into specifics, it doesn't make sense. You pretty much need to talk to an expert. Well, the other thing that I learned, Scott, is that you could go on site and you can do all this work and you can figure out what direction you want to go in on your own, or you can use the services of somebody like Scott and you're not paying for his services. So is that right?
That is correct. You can go online and you can be self-sufficient and go to medicare.gov and you can do all your research and you can even purchase online. And if you purchase a supplemental product, you pay X. You then are subject to an 800 customer service number when you need to have service or assistance. You can contact Medicare insurance companies directly and work internally with their internal sales team, and you can get assistance from them and purchase products from them. And again, you pay the same premium amount, X. Or you can work with a licensed certified Medicare insurance agent. And I'm not trying to toot my own horn, but annually we have to go through licensing and certification and we have to retest every year. And with us, you're calling us and we can be your ambassador, your advocate in working with a Medicare insurance company. And if you buy products through us, you're paying that same dollar amount, that same premium. So you don't pay any extra to work with an agent. You don't pay a consulting fee to work with an agent. If an agent says, I charge an hourly fee to do this, I'd be a little concerned about working with that agent. We actually, we get paid a commission by the insurance companies through which we place the product. So the insurance companies pay that, and the consumer pays the same premium whether they pursue any of the 3 avenues.
And you're doing Zoom consultations right now with people, is that right?
Absolutely. I'm totally paying attention to social distancing. I will do Zoom calls. If people still want to meet face to face, I'll keep at least 10 feet apart. I'll keep my mask on. I want them to keep their mask on. So I just respond to what my client needs.
Great.
I've had some where I fill out the paperwork all over the phone and I drop it in their mailbox with a little sign here, sign here, sign here, and then they sign it, leave it there, and I come back and get it later. So whatever works for the consumer.
Appreciate it. We have a question. I have insurance from the state. Does that turn into Social Security Part B? Is that right?
They have insurance, meaning group insurance from the state?
I think so, yes.
Well, sometimes state agencies will offer a group Medicare plan, and you'll need to check to see whether the group Medicare insurance is available through your employer. If not, you will need to separately go on and you'll need to sign up for Part A and Part B. Yeah.
Okay. Somebody is saying they don't see Scott's contact info in the chat. He just posted it again. So, and we have another question. Is this presentation videotaped? It is. We have a YouTube channel. So you can go to YouTube and then you just type in LT Senior Services and you'll see all of our videos from this year. As soon as the pandemic started, we basically started doing Zoom calls and now they're all on YouTube, which makes me a little self-conscious, but what are you going to do? Let's see. I'm having a little bit of trouble looking in here. Let me get my chat box. Yeah, his information, he just, oh, you posted it to panelists, Scott. If you would go ahead and post it again and you would say for all people or for everybody who's attending. Another, oh, some ideas for,
I wish I were more Zoom literate.
it's okay, we're all still learning. Yeah,
And so
just a lot of people are
I'm
saying,
gonna say, Natalie, how do I do that?
so just go ahead and put in the information and then you have a pull down where it says all panelists. You also have something that says to
I'm
all
adding it for you, Scott.
Oh, there you go. Natalie will do
I
it
was
for you.
hoping you'd make that comment, Natalie. Thank you.
You're welcome.
We have several people who are voting in our poll right now. I actually I'd like to keep it up because I think we've got some people who are still looking at it. So let me see if there's any other question and answers. Again, we had information. Yeah, I think we've answered all those questions.
Well, I see a topic here that says laws and rules when it comes to planning a funeral and how to save funeral expenses, not a funeral home. Well, this is a discussion on Medicare, and final expenses for funerals is separate.
This is actually, we asked people to put topics for future seminars.
Okay.
So yeah, we're kind of doing 15 things at once. Sorry about that. So yeah, so we're going to see topics in here, which is great for next year. So that's what that is.
I guess I would just point out that typically your licensed Medicare agent also is certified and licensed to provide hospital indemnity type of policies, final expense, funeral expenses, catastrophic cancer type of coverage. So if those apply, we can also help with that.
Excellent. Well, that's great. I am not seeing any additional questions, and Natalie posted your information, so everybody has that. That was a question that we were getting. I think we might be done. What do you think? Anything else? Any final words?
No?
It's complicated. That's all I'll say. My mom, she's 83, and so she'll come and say, what should I do? And I'm like, we need to talk to an expert. That book is thick. My head's spinning. I'm like, I have no idea. You really have to talk about your prescriptions and everything else when you're looking at the total package, right?
Yeah, that really is an important factor to look at is every year prescription drugs change in terms of how they're tiered. Now, how they're tiered means how they're categorized. And your insurance companies will have tier 1, 2, 3, 4, 5, with 1 being generic and 5 being the formulary cancer type of drugs. So sometimes things that were a tier 3 last year, which would be subject to a deductible and maybe $47 for the prescription, now have been reclassified to tier 2, where the deductible doesn't apply at all, and they may be able to get it for $6 or $12. And I kind of go back to a point I made, insulin. A lot of seniors are diabetic, and insulin used to cost a lot of money. And now suddenly there are some companies out there that are providing a substantially reduced rate in co-payment for insulin.
Excellent. So that's good to hear that it's going down in cost. And you're right, there are a lot of people who are affected by that. Let me just go to my poll real quick, and I'm going to go ahead and end it. And I'm going to go ahead and share the results if y'all want to see, just for your own benefit. But this is information that we will use for next year. We're so happy to get your feedback. It looks like I do have another question. Hold on. Let's see. Could you please go over the donut hole going away again? Great question.
Well, that could require a lot of detail, but historically, you get to the point where payments were covered. I mean, you pay your copay, and then you have a deductible that you have to meet, and then you got to this donut hole between, for instance, $4,000 to $6,000, where you had to pay those costs. And now the rules have changed such that you pay up to the 4160, and then you're subject to 25% until you get to the 6,000 figure. And then above that, you're paying a very small amount, the $3, $9, no more than 5%. So the donut hole as we knew it is pretty much gone away.
Excellent. Good to know.
I mean, for instance, I mean, you might have paid, $47 for a copay, and you're subject to a $435 deductible. And then your drugs might cost, the maximum allowable with Medicare might have been $150 for that drug. And you'd have to pay that until you accumulated up to that $6,000 level. And now they're saying it's 25% in that gap.
Excellent.
Yeah.
Okay. Well, without further questions or comments, let me just look in the chat one last time. I think we're done. And I want to thank you, Mr. Gidley, for coming. I know you don't like that. I'll just call you Scott. There you go.
That's okay.
Scott, thank you for coming. And thank you for being a great resource for seniors. I just want to tell everybody about the event next month. It's going to be discounts for seniors. So it's a perfect time of year. And we're going to let you know about all the different kind of discounts that you have earned. And we look forward to it. So that's next month. Thank you again, Scott. And we'll see you next time. Yeah, absolutely. Bye-bye.
Bye.